spinach, stay away from my door.
We'll tell the boogeyman.
Good morning, everybody. Thanks for being here to share with me a topic about food. It's hard to talk about food without talking about weight problem. As many healthcare providers and patients ourselves, we feel all frustrated that the only thing we're doing is condemning people for their love for food. And needless to say, it feels like a futile effort. If anything, we're dealing only with the complication of obesity. However, there are people that are succeeding in their struggle against obesity. Let's hear what they have to say to us.
Bueno, antes pesaba 185 libras y en menos de 20 días perdí 10 libras porque empecé a comer vegetales, todo lo que es vegetal. Mi hijo no le gustaban los vegetales. Ok, ma, quiero probarlo, ahora le encanta, todos los días quiere vegetales. Ahora todo el mundo está feliz, me preguntan ¿qué hiciste para bajar de peso? ¿Qué has tomado? Yo le dije, bueno, te voy a decir, no puedo tomar nada. Pero lo único que tienes que hacer es tú mismo, educar a tus hijos en tu casa y educarte tú mismo. Porque eso es lo mejor. Y mi vecina dice, Marina, qué linda te estás poniendo. Y antes se preocupaba por mí. Ahora yo le digo, quiero ayudarte a ti. Ahora que tú me ves así, yo quiero ayudarte a ti también. Y ella dice, está bien. Entonces estoy ayudando a ella también.
¿Ella también tiene diabetes?
Ella también sí está cayendo en diabetes. Y mi hija con mi dieta también bajó de peso. Con lo que comíamos los tres, todos estábamos bajando de peso.
Era de 311 libras. Y ahora yo le traigo la noticia nueva que he perdido 30 libras. Y me he inspirado en mi hijo a perder peso. Mi hijo está yendo al gimnasio, él está jugando basquetbol y siempre él que se va para el gimnasio me dice, papá, vamos al gimnasio para que pueda perder un poquito de peso más porque así estaba yo antes, él me decía. Pero que yo casi no estoy haciendo mucho ejercicio, estoy corriendo así a veces 20, 25 minutos, hasta media hora. Pero sí lo que estoy haciendo es dejar de comer en la noche y eso me está ayudando mucho, tomar mucha agua y estoy inspirado en mi hijo y mi hijo me ha dado apoyo para que yo siga perdiendo más peso.
When we think about food, we think more than just filling up our stomachs. We think about taste, we think about preferences, we think about emotions, we think about who we are, our identity. It is commonly said that we are what we eat. However, it feels very sad that we always have to say, yes, I have to give up arroz y tortilla. Yeah, I have to avoid pasta and pizza. And yeah, no dumplings, no rice. And after giving up all our favorite food, there still remains the question, what we can eat then? I work as a primary care physician in Chelsea. There's a group of patients in Chelsea that are more affected by the epidemic of obesity. A quarter of our patient population suffers of food insecurity. Ironically, people that do not have enough food suffers double the burden of obesity. So we wanted to understand a little bit more why. We talked with them, and we found out that most of them are very familiar with our nutritional advices. Yes, more fruits and vegetables. Yes, the issues of calorie-dense food. And as many of you have guessed, they feel that the main barrier to purchase healthy food are the food prices. However, the striking finding for us is that when we ask the question, would you change your diet if you have more money? They all answer no. So it's not about knowledge, it's not about money. What it is about that we eat unhealthy. One interesting perspective about the epidemic of obesity came from the findings of the study by Dr. Christakis, the spread of obesity in the social network. It is scary to know that if a friend becomes obese, our odds of becoming obese is double. And this effect goes beyond the immediate friend, affecting even friends of friends. So the question is that if a friend loses some weight, would we have higher odds of losing weight? We got some answer from the story of Marina and Juan. So through the Innovation Fellowship, we started working with a diversity of community organizations, including the Head Start program, the CAPIC, the Food Pantry, the St. Luke Church, the neighborhood developers, and together we have designed a survey that asks our community where do they seek information in regard to the food that they eat or buy. So far, we have gotten over 200 responses, and we're expecting to get double of that coming up. And here are some preliminary numbers. The majority of people seek information in the supermarket, followed by family. And within the family members, mother and then the grandmother are the biggest influencer. The WIC program. And yes, we do play a role. The healthcare center can have the same effect similar to the media and to friends and school. Our next step is to try to understand better how does this relationship and influences work. And through them, we're going to interview some of the respondents that have agreed to explore furthermore this topic with us. Within them, we're going to try to find out more people like Marina and Juan. Being obesity a social epidemic, we can probably bring the community together into a community and social solution so we can weave a social network that can undo obesity. Even though not nominated officially as an influence, almost 80% of our patients eat out at least once a week. We can see here that the social circumstances can increase our potential. Recently, I saw a patient that was newly diagnosed with diabetes. Her eyes shined when she started talking about her dream. Her dream is to open a cookie factory where children can come in and go wild with their creativity, making all types of cookies. And she told me, and I will teach them how to bake healthy cookies. Yes, she still can have celebratory food in her life. And yes, she can be a positive influence for our community. Together with people like her, like Marina and Juan, we can weave a network that can help our patients. After all, there's only a few minutes that our patients spend their life with us, and then they're back to their community with people that build their life with and share their life with. So let's start nurturing people like this and start nurturing our people so they can nurture their friends and families. Thank you and enjoy.